Hello everyone. Imagine a child suddenly having a seizures during a high fever. Panic sets in. But this is where we, as a nurse, come in. Today we'll be discussing about febrile seizures, what we need to know, and how to handle them effectively. So, today, allow us, Group B from IMC 2023, discuss about it with you. So this is our team. There's Dorothy, Erwin, Estafin, Florentina, Gloria, IMMI, Heavy, Irene, Jessica, and Felicia. And this is our learning objective.
The first one, when we talk about febrile seizures, we must know what is febrile seizures in children. Febrile seizures is the most common type of convulsive disorder and one of the most recorded causes of emergency hospital admission in children under 5 years of age, according to CBIB and Altufeli 2019. According to Leung Han and Leung 2018, febrile seizures are generally defined as seizures occurring in children aged 6 months to 5 years associated with a fever above 38 degrees Celsius without evidence of an intracranial cause. Another definable cause of seizure or a history of a febrile seizure. The second one, we will know about types of febrile seizures in children. The first type is simple febrile seizures. So what is simple febrile seizures? Is occur rapidly, like lasting less than 15 minutes, characterized by generalized seizures, is tonic or clonic, and do not recur within 24 hours. The another one is complex febrile seizures. Is seizures last longer than 15 minutes, involve partial seizures on one side or focal seizures, or generalized seizures that start with partial seizures and occur more than once within 24 hours.
Here have the identification of the cause of febrile seizures of children. Okay, the first is fever. Febrile seizures usually occur when body temperature reaches 100.4 Fahrenheit or 38 Celsius or higher. This fever is often caused by infection, especially viral infection like the flu and Brucella. Number two is infection. Viral infections are the most common cause of febrile seizures. Some of viruses frequently include influenza virus, is ANV, respiratory syncytial virus, or RCV, adenovirus, enteroviruses, although bacterial infection can also cause febrile seizures. This is less common. Number three is post-vaccination. Some vaccines such measles, mumps, rubella, MMR, or MMR vaccine, and diphtheria, tetanus, pertussis, or DTP vaccine can cause mild fever that might trigger seizures. It's important to note that the fever, not the vaccine itself, is what poses the risk. Number four is genetic factor. There is evidence that febrile seizures can run in families. Children with a family history of febrile seizures are at a higher risk of experiencing them. Certain genetic mutation related to ion channels might also play a role. As number four is age. Most febrile seizures occur in children between 12 and 18 months old, with the highest incidence in the first 24 hours after the fever start. And the last is underlying neurological condition. Most children who experience febrile seizures are otherwise healthy. However, children with certain neurological condition may be at higher risk of complication, or unnecessary presentation.
Next, the pathophysiology of febrile seizures in children. First, increased body temperature. Febrile seizures occur due to a sudden increase in body temperature, usually above 38 degrees Celsius. This can be caused by infections such as otitis media, pneumonia, or gastroenteritis. Second, inflammatory response. Infection leads to the production of pro-inflammatory cytokines. These cytokines can cross the blood-brain barrier and cause change in brain cell plasticity, including increased temperature and seizure potentiation. Third, neurological change. An increased body temperature can cause brain cell excitation. This neuroelectrical instability may occur due to the influx of ions such as calcium to channels opened by inflammatory cytokines. This can cause significant electrical discharge, leading to seizure. Fourth, different seizure thresholds. Each child has a unique seizure threshold, which is the minimum body temperature that must be reached for a seizure to occur. A child with a low seizure threshold can have a seizure at 38 degrees Celsius, while a child with a high seizure threshold requires a higher temperature, such as 40 degrees Celsius or above. 5. Genetic risks. There are indications that genetic factors influence the risk of febrile seizures. A family history of febrile seizures may increase the risk of febrile seizures in an individual.
I will explain sign and symptom of febrile seizure in children. There is eight of sign and symptom of febrile seizure. First is high fever. The seizure is triggered by a sudden rise in body temperature, often due to infection like a flu, ear infection, or etc. A body temperature is higher or above uh, 80, 38 degrees Celsius. The seizure may occur at the fever's onset before the fever is even noticed. Second, convulsion or jerking movement. There is two types of convulsion or jerking movement. First is general seizures is a common type, affect both sides of the body, involve rhythm jerking or shaking of the limbs, head, and entire body. The child may arch their back or have rigid muscle contraction followed by jerking movement. And second, focal seizure is a less common, affect only one part of the body, such as the arm or on leg on one side. This can be more concerning and may indicate other underlying condition requiring immediate medical attention. Third, loss of consciousness. The child usually become unresponsive during the seizure. They may collapse or appear to be in a deep sleep. There may be no awareness of the sounding, and the child may not respond to voice or touch. Fourth, eye rolling. The child's eyes may roll back into the head, revealing only the white of the eyes. They may also appear to stay blankly or have their gaze fixed in one direction. Fifth, stiffness or rigidity. The child may become rigid or stiff, particularly at the start of the seizure. This can involve the entire body of or specific muscle, such as those in the neck or arms. 6. Cyanosis, or we can say bluish skin. Due to irregular or shallow breathing during the seizure, the child may develop a blue stain around the lips, fingers, or toes. 7. Drooling or frothing at the mouth. During the seizure, some children may produce excessive saliva, leading to drooling or foaming at the mouth. And the last is cortical stage after the seizure. After the seizure ends,
The child often enters the postical stage characterized by confusing. The child may appear disoriented or not fully aware of what just happened. Drowsiness, they may be sleepy or need a nap, as febrile seizure can be physically draining. And the last, irritability. Some children are irritable or upset after the seizure. That is all the sign and symptom of the febrile seizure.
Next, we will explain about management of febrile seizures in children. And now we will talk about etiology and its relation to the nursing problem, especially for hyperthermia. So, when the viral or bacterial infection that enter the body through the respiratory system, digestive system, or open wound can cause inflammation. The immune system releases chemical called pyrogens, like interleukin 1, interleukin 6, and tumor necrosis factor alpha. These pyrogen enter the bloodstream and travel to the brain. In the brain, pyrogen affect the hypothalamus, which control body temperature. The hypothalamus raises the body temperature set point. To increase body temperature, the body reduces blood flow to the skin. That's why causing paleness, shivers, and speed up metabolism, leading to fever. This rise in temperature also makes neurons more excitable. As a result, the body temperature can go above 40 degrees Celsius, causing sustained hyperthermia. Prolonged hyperthermia affects the brain, making neurons unstable. This instability can lead to abnormal electrical activity in the brain, causing febrile seizures due to the extreme body temperature.
When seizures occur, the body requires more oxygen to support hypermetabolism or increased metabolic activity. The muscles work harder and the vital organs demand more blood and oxygen. Then, the metabolic stress caused by the seizures trigger the activation of the sympathetic nervous system, leading to systemic vasoconstriction, especially in peripheral blood vessels. This ensures that enough blood is directed to vital organs such as the brain and heart. Blood flow is redirected from the extremities to the vital organs. This results in a reduction of blood flow to the periphery, such as the hands and feet, decreasing the supply of oxygen and nutrients to the tissue. As a result of reduced blood flow to the extremities, ineffective peripheral tissue perfusion occurs, where peripheral tissue do not receive sufficient oxygen and nutrition to maintain normal cellular function.
There is etiology and its relation to the nursing problem. We're focused on the risk of aspiration. So, the pathology of risk of the aspiration is body temperature increase above 40 degrees Celsius. So it can sustain hyperthermia, stimulate the central nervous system, and then an increase in brain temperature disrupt neuronal membrane stability. Because of the nervous system of the children is very sensitive, that it causes abnormal electrical activity in the brain, leading to seizure. During a seizure, muscle loss control, including the muscle of the function to swallow and maintain the airway. So, the seizure lead to increased saliva production, which can enter the respiratory tract because the respiratory tract muscle is lost the control. So, it can make the decreased level of consciousness, decreased gag, and or cough reflex, and swallowing disorder. That's all the risks of aspiration.
There is the etiology and its relation to the nursing problem focused in risks of ineffective cerebral perfusion. First, when the body temperature increases above 40 degrees Celsius, that will disrupt neuronal function and causes excessive depolarization. And then it will be dehydration due to fever, reduced plasma volume, and causes hypotension. And then resulting in inadequate brain perfusion. And then triggers the excessive release of excitatory neurotransmitters. And then it will be abnormalities of prothrombin time or partial thromboplastin time, decreased left ventricular performance, and aortic arteriosclerosis. And there is the etiology of the and its relation to the nursing problem, risks of ineffective cerebral perfusion.
Okay, next, uh, etiology and its relations to the nursing problem of impairment of gas exchange nursing diagnosis. So the first one, it will happen apnea conditions, and then the apnea is make the CO2 or carbon dioxide to increase, and then go to the hypercapnia, and hypercapnia will make the blood pH decrease, and then the anaerobic will be metabolism, and there will happen acidosis, and go to the alveoli ventilation decrease, and then there will be signs and symptoms about tachycardia, dyspnea, and PCO2 increased, and there is uh, etiology and its relations to the nursing problem impairment of gas exchange. Thank you.
Fever seizures in children are a type of seizure that usually occurs when a child has a high fever, especially between the age of 6 months to 5 years. While they generally do not cause any long-term problems, there are some complications that can arise, especially if the seizures are prolonged or frequent.
Complex febrile seizure. Complex febrile seizure lasts more than 15 minutes, occur more than once in a 24-hour period, or are limited to one side of the body. More serious complications, such as brain damage, can occur in long-lasting complex febrile seizure, although it is very rare. Recurrent seizure, about 30 until 40% of children who have had febrile seizure will have them again. Children with recurrent febrile seizure are at a higher risk of developing neurological disorder later in life. Risk of epilepsy. Children with a history of febrile seizure have a slightly higher risk of developing epilepsy, especially if the febrile seizure are prolonged, there is a family history of epilepsy, or there is a previous neurodevelopmental disorder. The risk of epilepsy in children with febrile seizure ranges from 2 until 7% depending on the risk factor. Next, developmental disorder. In cases of very severe or long-lasting febrile seizure, there is a risk of neurological damage and developmental delay, although this is rare. Next, risks of brain infection. Febrile seizures can sometimes signal a serious infection of the brain or brain membranes, such as meningitis or encephalitis, which requires immediate medical evaluation. And the next, cognitive and emotional change. Children who experience recurrent febrile seizures may experience a slight decline in cognitive function, although most children recover without any long-term problems.
There are treatment and prevention. First, fever management. Parents are advised to immediately reduce the fever with antipyretics, such as paracetamol or ibuprofen. Second, seizure medication. If the seizure lasts more than 5 minutes, rectal diazepam or buccal midazolam may be used to stop the seizure. Third, family education. It is important for the family to understand how to manage seizures and when to seek medical help. And last, neurological monitoring. In children with complex febrile seizure, further monitoring may be required to detect any neurological disorders or epilepsy.
Okay, next, we will move to supporting examination and diagnostic of febrile seizure in children. Anamnesis. Anamnesis helps determine the cause of the seizures by gathering detailed information about the child's health history. The importance of this step includes seizure cause, family history, triggers, and other illness. Anamnesis is crucial is it the first step in determining whether the febrile seizure is an isolated event or linked to a more serious illness. Okay, next we'll move to advanced examination. Advanced examination are performed when there are signs that the febrile seizure may not be caused by a simple fever. Key reasons for this test include EEG, electroencephalogram, done when the seizure is atypically. EEG help assess abnormal brain electrical activity that may suggest epilepsy or other condition. The second one is CT scan or MRI of the head. Use this detect structural abnormalities in the brain, such as tumors, bleeding, or brain injury. This is essential if the child has focal seizures or unexplained neurological symptoms. This advanced test ensures there is no more serious issue with the brain, especially if the seizures are more prolonged or show usual patterns. Kok ngomongku kayak aneh kali ya? Udah deh. Oh udah. Abis itu gimana? Save dan exit.
Okay, for the evidence-based practice, we take an intervention from temperature regulation. Okay, the observation, monitor the baby body temperature until stable, monitor children's body temperature every 2 hours if necessary, monitor blood pressure, respiratory rate and pulse, monitor skin color and temperature, monitor and document signs and symptoms of hypothermia or hyperthermia. The therapeutic place continuous temperature monitoring device if needed, increase fluid and nutritional intake as appropriate, swaddle the baby immediately after birth to prevent heat loss, place low birth weight babies and plastic immediately after birth. Use a baby hat to prevent heat loss in newborns. Position the newborns under the radiant warmer. Maintain humidity in the incubator at 50% or more to reduce heat loss from evaporation. Adjust incubator temperature as needed. Warm items that will contact the baby. Avoid placing the baby near open windows or areas with air conditioning or fans. Use warming mattress, warm blankets, and room heaters to raise body temperature if necessary. Use cooling matters, water circulating blankets, ice packs, gel pads, or intravascular cooling catheterization to lower body temperature. Adjust the ambient temperature according to the patient needs. Education. Explain how to prevent heat exhaustion and heat stroke. Explain how to prevent hypothermia from exposure to cold air. Demonstrate kangaroo care techniques for low birth weight babies. Collaboration. Collaborate in the administration of antipyretics if needed.
Okay, next. So, in this slide, there is a reference that our groups used. Okay, now this is the end of the slide. We already explained all the explanations for febrile seizures, and thank you for watching till the end.